All right, let's find out who you guys are. So how many of you are leaning towards pre-med? Cool. How many of you are leaning towards pre-pharmacy? And for those of you who did not raise your hand yet, tell us your story. What are you leaning towards, or what are you thinking about? Or are you a high school student? And anybody in the audience that's undecided, totally no idea? Okay, fabulous. We got a good mix. Looks like pre-pharmacy is the majority, but we are glad that we have a variety of people here today. So I wanted to start out with a story. And I hope this gets you in the right mindset of what we'll be talking about today. So I want you to start out by thinking about your dad. Or if you don't have a great relationship with your dad, think about some other male figure in your life who's been really important to you. Think about somebody that would be sitting at this dock with you when you were a little kid. Somebody who cared about you and would make time for you when you grew up. When you came home from school upset, they would try to cheer you up. When you were a teenager and started hanging out with new friends, they would be concerned. Who are you running around with these days? And as you grew up, this person, your dad, let's call them, also has gotten older. And let's say 5 years from now, your dad starts having some health problems. Maybe you notice that he hasn't been eating very healthy and he doesn't exercise regularly. Your dad has a heart attack and he survives. He also gets diagnosed with diabetes. He gets put on a bunch of different medications, including benzapril, which is an ACE inhibitor medication, and atorvastatin, a statin medication to lower his blood pressure. And he also gets put on insulin to control his diabetes. You make an effort to see him, and maybe you take him fishing, or do something that you used to do when you were growing up. He tells you he doesn't understand his medications. He gets confused by all the different specialists he sees. He's overwhelmed by the healthcare system, and it's costing him a lot of money. You feel like all his different healthcare providers are not working together to provide him the best care. And that's why we're here today. If you want quality care for your dad, you have to know how to work in an interprofessional team.
So in listening to that story that Sarah presented, we wanted you to think about a couple of things. So she mentioned that this male figure in your life is taking multiple medications, which oftentimes are expensive. They're having some complications in understanding how to take their medications and maybe even the why they're taking these medications. So one of the things we want you to think about as we go through this presentation is why is our healthcare so complicated, complex, and expensive? That is the first question. And the second question we want you to think about is, so as your role as a future healthcare provider, whether it's pharmacy or any of the many others that there are out there to choose from, how do they work together to promote quality care, and how do they work together to save money in that system? And maybe even what are some most recent legislation that we've seen either at the state or federal level that addresses those issues? So some of the things we want you to keep in mind today as we have this conversation.
So as I was putting this presentation together, and I was getting overwhelmed, right? Because there are so many healthcare providers, and there is such a complex healthcare system in this country. So I said, okay, let's like rewind. Let's go back hundreds of years and figure out like how did we get to where we are today? So we got to look at our history, right? Because our history tells us the path of where we are right now. So just think about it. Like, and this is like the only picture I could find of somebody from like any amount of years ago. So like, just think about somebody who got sick 300 years ago, 400 years ago, 1,000 years ago, even 150 years ago. Who would be providing their health care? most likely, if you were to go anywhere in the world, any hundreds of months of years ago, you're probably going to run into a situation where you have maybe one healthcare provider in that community, right? And they provide everything that's needed. The diagnosis of that disease, and the treatment of that disease, and the follow-up, and any kind of intermediate care in between. Everything was probably done by one person, maybe two if you're lucky. And they sort of had this one-size-fits-all role for taking care of people that got sick. But then fast forward to today.
So we wanted to present you with an image of what today would look like. So as you can see from this image, there's a variety of people in the room. Just by a quick raise of hands, who do you think may be in this room caring for this patient? What type of providers? Anyone? How about you? The nurse. Anyone else? The doctor. So in this picture, there's several individuals working in collaboration to serve the needs of this patient. And they can range from physician assistants to the doctor to the nurse, as you all mentioned. And in a professional education and a collaborative practice, it's two or more professionals learn with, about, and from each other to enable effective collaboration and in order to improve the healthcare outcomes. So they're all working together with one goal in mind, is that we want to work with this patient, but we want to improve the outcomes for this patient as well in collaboration.
So we wanted to just break down in really simple terms, because the focus of this presentation is about physicians and pharmacists. What are their different roles? And essentially what it boils down to is a physician is a disease expert. That's where their expertise lies. So when you go to medical school, you are studying diseases, how to diagnose that disease, what are symptoms of that disease, and then what are the different treatment options for those diseases. And if you go to pharmacy school, you are trained to be the medication expert. So while the physician is in charge of diagnosing, the pharmacist is in charge of the medication use for that patient. And so that's sort of the really basic breakdown. Jumping back to that last slide that we just had, part of why our healthcare system is so complex is because we understand diseases so much better now than we used to in the past. And diseases are complex, and people are complex. And so that's part of why we have so many different health professions, is because the care needs and the understanding of how to best care for patients has really developed over time. So people have needs from a nutritionist, and for physical therapy, and for medication management, which is what pharmacists do. And there's just this whole variety of different needs that a person has, and since human evolution has gotten to a point that we understand diseases so much better, but we also have so much technology and so much information. That's part of why we have so many specialty areas, different kinds of healthcare providers, because they each provide a different kind of piece to the puzzle. So we wanted to show you a video. Yeah, I have to escape. Oh, help with the computer again. Thank you. So we wanted to show you a video, and this shows the interaction between, nope, it's gonna be that. Not quite ready yet, but yeah. There, oh, you're so good at that. Okay. So this video highlights a pharmacist in a primary care clinic, and shows you from the physician perspective and from the pharmacist perspective how their roles interact.
Hi, I'm Christina Sapoli. I work at Community University Healthcare Center in Minneapolis, Minnesota, and this is a day in the life of a pharmacist. people get confused when I say I'm a pharmacist and I work in a clinic, and I explain that I work with patients one-on-one to fix all of their medication-related problems and improve their health outcomes. A lot of the patients that I care for are ones that have many chronic conditions and many chronic medications. So there can at any time be between 10 and 20 some bottles that the patients are bringing in of various medications that they're bringing from home that they take. We work really hard with the patients to not only educate them about what they're taking, but then also making sure that what they're taking really is the best regimen for them. The advantage is that I'm able to meet with the patients one-on-one, sit down with them, and go over what their concerns are. And that's really where the best decisions can be that can have great impact on patients' lives.
My name is Dr. Chris Reif. I'm a family medicine doctor and Director of Clinical Services here at Cook. Medication management that Christina and her team brings to our team is very important. A number of the people that we see here are immigrants and immigrant families. They often come with quite a sort of like backlog of health problems and health conditions. So we often have to start them up with a number of medications at one time. We consult back and forth, so it feels very collegial. So Christina is vital, as with the rest of our team, in helping our patients get the best care.
I chose to go to the University of Minnesota because of the opportunities in seeing patients and learning.
Okay, so I was just going to stop it right there because then she goes into some patient examples. And then if you want to jump back to here, that'd be great. If you want to stick around here, we have a few more.
So one of the things to take away from that video is that it's very collaborative. Everyone in that environment, they're working in a team. So and every member of that team relies on each other. So we wanted to mention, I mentioned earlier some of the changes in federal legislation, and then we can look at on state level as well, around looking at the cost of health care. And so with the recent legislation around the Affordable Care Act from 2010, it's done some things in terms of removing barriers, creating access, increasing the number of people who have access to health care in our system. But there's still some challenges that need to be looked at over the long term. So challenges around, are we really decreasing costs, and how do we evaluate that through the different systems that they're proposing? So the bundle payments, incentives to reduce readmission rates, electronic health records are some of the things that have also been outcomes of that policy. But are they decreasing costs? And if not, how do we look at that over a long period of time? And then how are we evaluating increasing quality care? And so although this policy has done some things for our country in terms of healthcare and creating access and removing barriers, there are also still some challenges associated with the costs that we have to look at even further. And a couple things is that when you think of policy to think about is that they're intended to be transformative. So we're trying to transform our healthcare system in order to make it better, and cost is a big piece of that in terms of transforming it.
So even though the Affordable Care Act was passed, not all of its goals have been achieved, right? And one of the institutes that is really working hard for changing things and making it better is the Institute for Healthcare Improvement. And they are focusing on what's called the triple aim. Has anybody in this room heard of the triple aim? Okay, this is extremely valuable for you. If you're applying to any health program, you should know what the triple aim is, because this is what healthcare organizations and the whole federal government and everybody is caring about the triple aim. Even at primary care clinics, this is what they're going after. So essentially the three parts of the triple aim are to focus on population health. So not just looking at when we have a problem, we're gonna fix it, but looking at what is the health of our population in general, and what are areas that we can focus on for preventative measures so that we don't go down the road of having more and more people with chronic conditions. So that's one piece of it. Another piece of it is your experience. And this is what I was trying to get at with the story about your dad. That patient experience is extremely important. So the care that somebody receives isn't just did they get the right diagnosis and did they get the medication or the treatment they were supposed to get, but what was their experience? Do they feel like they're informed about their health condition? Do they feel empowered to take control of their health? So that's a big piece. And then the per capita cost is just controlling the cost. And a big part of the movement in healthcare now is not fee for service, like you go in, you get an MRI, and your insurance company pays a fee for that. It's if you get better, that clinic gets paid. So it's not just providing services, but it's making sure that that patient is getting better. So we're not providing service, and that patient never gets better. So that's part of the controlling of the cost, is putting the responsibility of that patient's actual health onto the healthcare organization that's providing it. So I wanted to show you a quick video that helps sum some of this up. I don't know why I did that. Sorry.
Is today's healthcare system so complex we've lost track of the patient? Back when doctors made house calls and prescriptions were filled at the corner pharmacy, everyone knew a patient's history and came together to care for them. But things have gotten complicated. Today, chronically ill patients might see 10 separate specialists, get 12 prescriptions filled at 5 different pharmacies, and go to the ER whenever symptoms flare up. Sometimes, the only person checking to see if they're getting better is a caseworker who doesn't have the time or resources to constantly track down which treatments and medications they're on. Patients can feel frustrated, confused, and alone. Instead of getting better, their disjointed care makes things worse. And as their health declines, costs to the system skyrocket. The chronically ill make up less than 20% of the overall patient population, but account for 80% of total healthcare spending. They often fail to keep up with the medications their doctors prescribe. This results in increased hospitalizations and wastes up to $290 billion a year. That's like throwing out $1 million a day every day since the year 1218. Money that could be spent improving healthcare for everyone. The system is fragmented, complex, and patients are falling through the cracks. But that doesn't mean people don't care in healthcare. It means we need to come together in new ways to support patients, coordinate treatments, and eliminate waste. We can foster better collaboration among physicians, pharmacists, providers, caseworkers, and payers to close the gaps and give everyone a complete view of what the patient needs. And we can improve communication so patients follow treatments and receive coordinated care. Compassion can thrive again in healthcare if we can find the courage to collaborate.
So Simone, what are we doing at the University of Minnesota to address this?
So of course, part of this presentation, we have to do a little bit of a PSA for the university, since we're both from the University of Minnesota. But we do have some really great facilities and programs and centers on our campus. Being a large public land-grant university that's research-driven, we house the National Center for Interpersonal Professional Practice and Education, and their focus is all around that triple aim. Their mission is to provide leadership, scholarship, evidence, coordination, and national visibility to advance the interprofessional education in healthcare. And so this is housed right within our academic health center. And this is a national center. They receive millions in funding from a variety of places, $4 million on a federal level, over $8 million on a foundational level. And this is a 5-year agreement that they're working around those goals that I mentioned. And what they really do is study the way health workers work together, but not just the workers. Students are part of this picture, patients, and what happens outside of that environment of the hospital or the clinic, what happens at home with those patients. So really looking at what does the whole system look like for patients that are receiving health care and who all are involved. So having this in our backyard is part of the Academic Health Center, and I'll just go through a little bit of stats regarding our Academic Health Center. So how many of you have been to Minnesota? Just to give me a little bit of frame. Okay, none of you. It's lovely. Summers are lovely. It's cold, yes, in the winter. But within our campus, we have actually 3 campuses in the Twin Cities. We have our East Bank, our West Bank, the Mississippi River crosses or divides the East from the West Bank, and our St. Paul campus. The Academic Health Center is located on our East Bank of campus and really nested among all these buildings that you see in the image. So although our campus serves over 50,000 students at all levels, undergraduate, graduate, and professional, within the Academic Health Center, they serve 6,200, around over 6,200 students that are currently enrolled across all of the programs. So vet science, medicine, pharmacy, nursing, public health. Am I missing any? Physical and occupational therapy. The Academic Center is a $1.2 billion enterprise. The university does not own our own hospital, but we have over 24 partnerships with hospitals within the state, and we actually have a hospital on our campus. Although it's not ours, we have a strong partnership with that hospital. And it lives within 2.4 million square feet and over 59 buildings across 3 campuses. So it's quite large, but it's all nested together for the most part. Our vet school's on our St. Paul campus, which is about a 10-minute shuttle ride away.
So Simone and I are neighbors. She works in the medical school, I work in the pharmacy school, and that's essentially how all of our health professions are. We're all right next to each other. And so what that means for you is that you, in coming to the University of Minnesota, will have an education in interprofessional care. So I want to give you an example of what that looks like if you come to our pharmacy curriculum. And just so you know, in general, all of our health professions is working to embed in every semester of their educational programs interprofessional components. So within your pharmacy curriculum, you start out pharmacy school. You start out pharmacy school with a course called Foundations of Interprofessional Communication and Collaboration. I've been a facilitator for that course for a number of years. And essentially, it's a course with all of the health professional students. There's about 1,000 students in that course, first-year students, from medical, dental, physical therapy, occupational therapy, veterinary medicine, and a few others. But essentially, it's a course that you take together. So you're learning from each other and with each other about what your role is in taking care of patients. We also have the Institute of Health Patient Safety Certificate, and we also have the Clarion Case Competition, where essentially you're given a real-life example of a patient issue, patient problem, and you're on an interprofessional team and you solve that problem. And it's a national competition, but it's housed at the University of Minnesota. So no matter where you go to school, you may be participating in that, but it's the University of Minnesota is like the founder of that. We also have a community teacher experience with the School of Nursing and Medicine. So you go out into the community and you actually have a patient that you're working with those other health professionals, and you're getting to know what that patient experience is in being treated by all those healthcare providers. We also have a simulation of transitions of care. So transitions of care is where a lot of issues happen with patients, where they're moving from the hospital to home or home to a nursing home, and that's where a lot of things fall through the cracks and their care usually plummets when they're in that transition time. So we have a simulation that's for that, which is interprofessional. And then you also have required as a part of your pharmacy program, you have in your 4th year of pharmacy school, you do all rotations in all different areas of pharmacy. And one of those required rotations is in acute care. And we have it so that each of our acute care rotations have an interprofessional component to it, which makes sense because you're not going to be alone in an acute care situation. You will automatically be with other healthcare providers. So that's just an example for the pharmacy curriculum, and all of our health programs have interprofessional components embedded into the curriculum. So, let's go back to this example of dad. And I wanted to have some interaction. You guys just shouldn't sit here all day, and we shouldn't talk all day. So I wanted to give you some time to interact with at least one other person in this room. So I will ask that you find at least one other person, and you could be groups of 3 if you want, but have it be interprofessional. So if you're pre-pharmacy, do not sit with another pre-pharmacy person. Find somebody else that's either undecided or looking for a different health profession perhaps. And I want you to talk about these 3 questions. So I have one last video. So it's taking that example of dad that we started with, and then I have a video of a dad. And I want you, after you watch the video, to talk about these 3 questions. So I'll give you a few minutes to find your partner or trio, introduce yourself, and then we'll play the video, and then you can answer the questions. Okay, so go. Find a partner or a trio. And introduce yourself, where you're from, that kind of thing.
Keeps flipping back and forth. Just like you have 2 monitors.
It's just hard to see from here.
But you can figure them out.
So I should stand over here. Okay. Thank you guys for being awesome participants. This is the beginning of your interprofessional education. So I'm going to show the video. It's only, it's very short, and then I'll have you answer those questions with your group. And by the way, this was filmed at the University of Minnesota. It's sort of corny, though.
Now that we've gone through your labs, let's talk about your medications. Well, it's good that you're already on an ACE inhibitor and a statin.
He doesn't take them regularly. I tried to remind him.
And it's important that you take those medications as prescribed. Your heart isn't working as it should. So, I think we should also start you on a diuretic.
What's that one for?
It helps get extra fluid out, which can be a problem with CHF.
Do you know how much these new medications will cost?
No, I really don't.
Will our insurance cover it?
Some diuretics are on a generic list. Your pharmacy should know. I believe this one's on that list, but I'm not really sure.
With the insulin he already needs, we just can't afford any more medications. How important is this new drug? Does he have to take it every day?
Hopefully insurance will cover it. All right, so I've got you started on the diuretic, and I've also just requested a referral to a cardiologist. Looks like we've covered everything. Thanks for coming in today, and the medical assistant should be in with your paperwork.
I just don't want to take any more pills. I've got enough already.
But dear, the doctor says you have to.
Got it. All right. Now, gotta figure out how to navigate back. Hang on a sec. He taught me how. I just have to go. Hit escape. Thank you. Now go to the right. Okay, great. So if you can answer these questions in your group, and then we'll give you a few minutes to do that because we have 10 whole minutes left. So I'd say about 5 minutes, and then we'll bring it back to everybody. All right, are you guys ready to discuss? All right, tell me, let's see, who would be willing to share some of the things that you brainstormed for number 1? What are some questions that went unanswered? The cost? Yeah, how much is it gonna cost me? Because guess what? 30% of prescriptions never get filled in our country. Why? Partially because people can't afford them. Or they don't understand, why do I need to take this? Okay, so cost. How much does this cost? What else? What are other questions that went unanswered? What's that? What's a diuretic? Yeah, he didn't really explain it that well. Like, that patient didn't seem to quite get it. And there was only a 1-sentence explanation. Other questions that went unanswered. How often he has to take that medication. Is it important that he takes it every day, or is it the kind of medication that you don't need to take every single day for it to be effective? What other questions? Will the insurance cover it? Other questions that went unanswered. Or are there things that might have just been confusing? Yeah. So the person who was the healthcare provider didn't really go into depth about like why was this important. Like you said, it's important for you to do this, but why? Like, what is the overall impact on this person's health? Are they gonna like die if they don't, maintain good treatment of themselves, or, is it a minor thing? One of the questions I had was that healthcare provider used an abbreviation, CHF. What is that? Normal person would not know what an abbreviation of a disease is. What were some other things?
Why is he going to a cardiologist?
Why is he going to a cardiologist? Like, do you think he's going to actually go to that appointment if he doesn't even know why? So there were a lot of unanswered questions. So what did you guys come up for number 2? Yeah.
I don't think his medical condition will improve because I remember I think he's like, I have enough pills taken, and I don't think, like, by the way the physician was reacting to this, I don't think he would have, like, told the pharmacist that they had taken this many pills. And because of that, the pharmacist could probably give them these other set of pills, and it could come into interaction and something would go wrong.
Right. Other people, what conclusion did you guys come to? My own conclusion, yeah, probably not going to improve. That's my conclusion. And partially why? Because he needs a better care team, right? So who do you think should be on his care team? Pharmacist, yeah, I would agree, because he's on a lot of medications and he doesn't understand them, doesn't know if he can afford them, doesn't understand why he needs them. Those are all things a pharmacist could cover. Who else should be on that care team?
The insurance provider.
Insurance provider. And that could possibly come in the form of a social worker at that clinic, because usually social workers are able to help the patient navigate all of their costs and where is it coming from, and if they're not covered, if their insurance doesn't cover something, social worker can help identify some services that might. Who else should be on that care team? Yeah, in the back.
Is primary physician.
Primary care physician, yeah. If that healthcare provider that was in the video wasn't their primary provider, they certainly need one to coordinate all their care. And sometimes the care coordinator, by the way, is not a primary care physician. It's a different healthcare provider at their primary care clinic. I also had on my list a nutritionist, perhaps. And if his diabetes gets really bad, if he loses any function, a physical therapist or occupational therapist might be appropriate as well. So those are just some examples of other people. So we just wanted to highlight a few other things that the University of Minnesota does.
So we have Hope Clinic and the Phillips Neighborhood Clinics, which are student-ran clinics. So those are places where you would see more examples of where this type of collaboration can take place. And these are student-ran, so students manage the functions of these clinics. And then the Clarion Case Competition comes out of the National Center, where students work in diverse teams to certain goals in mind to actually compete in small teams around interprofessional care and challenges. And then the Center for Health Interprofessional has their own educational programs and research that comes directly out of that center.
So my closing question for you is, every day as a healthcare professional, you're going to be taking care of people's dads, just like this guy and like your dad. And you're also going to be taking care of their moms and their brothers and their sisters, and you're going to be just taking care of a lot of people who matter in your life and in other people's lives. So my question for you is, how are you going to equip yourself to be a part of that interprofessional team and provide the best care for those patients and also save money for our healthcare system? So what kind of care do you want them to have? So thank you all for coming to our presentation. If if you have that blue sheet for the evaluation, if you wouldn't mind just bringing it down, and then we have a lot of optional materials, including a printout of the National Center at the University of Minnesota, and I have a lot of other things, including this has all of our health professional programs on it. So if you could bring those down, and have a great afternoon.